So now comes the time to announce the Hope Award winner. I don't know if you've had a chance to look in your books tonight. It's really hard, every year now because we have such wonderful submissions, but we want a chance to share all the wonderful work. So we decided that from this point forward, for the top three, that we will start to put in the booklet for the dinner going forward every year. So you have your three finalists there that you can read all about. They're doing incredible work. But of course, we decided as an organization, the first year we had a tie, that we would never allow for a tie again. And it's kind of funny because there was a tie with the selection committee. Then our process is we go to the board of directors. Then there was another tie because we couldn't get in touch with Dorothy, who was out of the country. And then finally, Dorothy broke the tie. So we did get a winner. But I wanted to tell you a little bit about the Hope Award. A few years back, we had a community engagement committee that helped us, how do we engage the community? And one of the things they thought about was an award not only to bring attention to the work of MITS, but also to highlight the work of others that are doing similar things to MITS, so that we could bring attention to other people's work as well. We thought it was important to just create more space in this arena. So the Hope Award stands for honoring outstanding people everywhere who further the MITS mission. And I believe, it's the 5th year today, this year, but I just want to mention that it's RL Solutions' 4th year for sponsoring. And Sanjay said that, MITS is like part family. We feel the same way with the RL Solutions team. And I had the privilege of going to their user group. If you haven't gone, it's the best conference I've ever been to. We went to Disney, I got a Mickey Mouse trophy, but more importantly, there's well-intended people who are doing some incredible work, and they highlight all their clients' work, and it's incredible. I never felt more. I told Winnie when I got back, Winnie, next year we're going to the conference again, both of us, because it was so inspiring. They're a wonderful group of people. Winnie thought I should point out something, and one of the things that Winnie thought I should point out is, Sanjay, are you the first person ever to have unlimited vacation for your staff? Does that happen anywhere else? Yeah, so I know a few people at my table want to send a resume now, so just so you know. But I want to introduce you to the sponsor, and I think they're going to be always a sponsor because this sits close to their heart. But Sanjay, for a few years I couldn't even say his last name, and I can finally say it, Malavaya. He's a wonderful man and a kind-hearted person, and he's going to introduce the Hope Award winner. Thank you.
So I spoke earlier. I told you I was going to come again, and I apologize for it. But now we're here. I alluded to earlier, we've been sponsoring this award for a while. Linda's mentioned that already in her talk. And I'm always moved by the submissions that we get. And so this year, I was reading through all the Hope Award submissions at a conference, the Ashram conference. So a lot of risk managers in the room. I was there reading through them. And for those of you who are new to MITS and new to RL Solutions, I have to tell you that I tend to get emotionally invested in some things like the MITS vision. And so there I was alone at the bar. I was intently reading these submissions. And not so discreetly, I was wiping away some tears as I was reading some of the touching things that were being said. And next thing I know, the waiter brought me a free drink. And I kind of started to notice some strangers were looking at me like, I hope he gets better. I hope he gets better. And then there was our client, Memorial Care from Los Angeles, and the VP of Risk came over to me and he said, you know what, I'd love to pay your bill. I said, no, that's cool. But in the end, I've decided from now on I'm going to read all MITS or Hope Award submissions in a public place and hope I get the same kind of response. And we've been so privileged over the years to read so many inspiring stories like the ones I was reading this year. And all over the country, there's so many great, rich stories of people supporting patients, families, clinicians during the course of an adverse event. And lately, we've been in discussions with Linda and other folks at MITS about how RL can play a more meaningful role in the MITS vision. And we've come up with a way to actually implement some of the MITS values in our software. And when I mentioned earlier, many of our clients are here today, and some of them are implementing some of the constructs of the MITS vision in their organizations. So when we talk about things like peer support within the hospital, or promoting a referral process for patients who've experienced an adverse event, you know what? Software can do a lot for that. Simple things like sending real-time alerts, simple things like creating customized forms that can really support this process are easy things for us to do, and there are things that we've committed already to Linda to help implement in our product. And it just shows what Linda said is very true. We feel the MITS vision in our heart. We're not technically here as a vendor. We love being here. And I hope we can be here for many, many years to come. And all this talk leads very nicely to the winner of this year's Hope Award. And before I get there, Linda already stole my thunder. We say this every year. You know you know that the voting was close, and you know that there was a tie. You know that it went to a single person. But I think what I want to say is that all the people who were in your program as people who were the finalists of this award truly deserve it. I think if somebody had had a drink before they voted, it would have changed. It was that close. So, you know, in a pragmatic way, I think I am privileged to congratulate Dr. Tam Gallagher for being selected as this year's winner. So he graduated with a BA in religion from Carleton College in Minnesota, and at that point, I think I could have gone toe-to-toe with him, you know? Guy with a BA, whatever. But unfortunately, after that, he caught the fast train to smartness, and then he became a doctor from Harvard, somewhere around here. And then he did his residency at Barnes Hospital in St. Louis, and then he got a Robert Woods Johnson Clinical Scholars Program and completed that at the University of California in San Francisco. And then he came back to Barnes Jewish in St. Louis. And you know what? All this name dropping reminds me of something. All those clients our hospitals are clients of RL Solutions. But I digress, right? And then he went to the dark side, and he's been at the University of Washington, where they clearly don't understand great software yet, right? Tom's going to fix that. And then, you know, over the last decade or so, Tom's been a driving force in creating tools that drive major advancements in how we respond to patients and families and clinicians following a significant adverse event. And his work is especially relevant in his ability to collaborate with people who traditionally we don't think of as good people, like lawyers and regulators. And he's written a lot of books, 70 chapters, papers. I'm not one with details, sorry about that. And he's put his training in medicine, bioethics, to a lot of practical use. And in Oregon, he's worked with hospitals and the Oregon Patient Safety Commission to ensure that written notification from physicians doesn't fall into the typical form letter cold approach, but is more warm. And I can't help but note that that's going to kill the form letter feature that we've created in our software. Thanks a lot for that, Tom. Lately, his work has moved beyond disclosure to considering the broader response, like we see at the University of Michigan, to medical injury, where we're proactively disclosing adverse events and timely investigation and explanation and apology to patients, which has shown great value to families, and where appropriate, early offers of compensation and other assistance. And under his direction, with the support from ARC, he's developed and is implementing across Washington State a very innovative disclosure and resolution program. And to develop this program, he's created a unique statewide collaborative approach called the Health Pack Forum. And it's provided a platform for collaboration among advisors, healthcare providers, institutions, malpractice insurers, a bunch of folks. And I remember I called Tom before this because I kind of like to get to know people before I talk about them. And I finally heard him wax lyrical about all the stuff he's doing. I didn't understand half of it. And I said, Tom, you're getting all these people in a room. They don't typically like each other. That can't go well. And he said to me, Sanjay, I have to admit to you, I'm not always the most popular guy in a room. And that's why today I'm so proud and happy to introduce the most popular guy in the room, Tom Gallagher. Congratulations.